Hello, my name is Dr Dan Cowie. I'm a GP in Gateshead and I'm also working for Newcastle and Gateshead CCG, helping on transformation. What I want to talk about today is the National Vanguard programme and the successful bid from Newcastle and Gateshead CCG and Gateshead Local Authority for the care homes model within the Vanguard programme. There was around 260 applications for the new models and Vanguard sites, and Gateshead was one of the 29 chosen sites. We were successful in the enhancing healthcare within care homes model. So therefore, going forward, and what is the Vanguard all about? The Vanguard for me and for our system is very much around changing the way we provide and commissioning services going forward. It's very much around using people, public, providers and commissioners working together to think about designing the system and delivering the system in a new way. As I said, we've been very successful in getting this bid. We started a lot of clinical work within the care homes in Gateshead back in 2010, and we've had a steady reduction in our non-elective admissions into hospital from people within care homes by introducing GPs within the homes, working with older people, nurse specialists, and working very closely with our therapy colleagues and local authority colleagues. So where do we want to go from here, and how can the Vanguard programme actually help us? We see it basically looking in four main areas. Really looking about how we commission differently the community beds and the care homes and home-based services in Gateshead, and really get a joint approach to commissioning those services. The next thing is very much around the provision of these services. We really want to align the provision of these services and make a system for delivering community beds and home-based care. And we want to create an organisational culture that sees themselves as part of this service, not as part of different organisations. And we know that will be an evolving model, and that will have a much bigger influence and implications for service redesign across Gateshead, both across the health sector and the social care sector. And finally, to support all this and the big enablers, we really want to look at new contracting models around this. We want to be focusing on possibly introducing new contract types, and also looking at new payment models where payment is very much linked with outcomes, and we reward innovation and better care for patients. Therefore, we see the Vanguard programme as a real catalyst for us supporting that wider integration across health and social care, between health, and really supporting the population and working with our local community to improve health and social care in the broadest of sense.